Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare profession. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted yet so profoundly impactful. Hello, everyone, and welcome to another episode of Muted in Medicine podcast. My name is Saba Fatima, and I will be your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare, which often they're unprepared to face, and spreading more awareness about it. And with this podcast, we hope to discuss some of the most taboo topics in medicine that are often not openly discussed. Today, we're talking about mental health. One of the topics in medicine that is often lurking in the corridors, but never discussed openly, despite the glaring statistics. There was a recent study in JAMA which found that suicide rates were significantly higher in healthcare workers in the US compared to non-healthcare workers. According to the 2024 Medscape survey, 49% of the physicians were burnt out and 20% were depressed, which is significantly higher from the prior years. Every few months, I see the picture of a young, bright physician or a trainee who took their life. And despite these glaring numbers, often this conversation is so hard and never out in the open. As a trainee, you will never hear someone higher in the hierarchy talk about this with ease. And so today's conversation will focus on breaking some of those barriers. I love this quote which says, "Mental health problems don't define who you are. There's something you experience. You walk in the rain and you feel the rain, but you're not the rain." To discuss this with me today, I have Dr. Melissa Hopper. She's a clinical psychologist and she specializes in eating disorders. She also helps trainees with burnout and grief and supports many wellness activities at her institution. Dr. Hopper has recently done a lot of work in fighting shame in medicine and also promoting self-compassion. Dr. Hopper, welcome to the show.
Thank you. I'm glad to be here.
We start our podcast by asking everyone a slightly positive question. What brings you joy in medicine today?
Oh, such a good question. And I think something that we all have to reflect on every once in a while. So what I would say brings me the most joy is working with trainees. So our residents that we work with, that brings me immense joy to see them begin their residency, intimidated and nervous about the next few years, and then end it these confident, competent physicians. So I would say that definitely brings me joy.
Yeah, and I would say you're definitely a big part of their journey as well. So I think that kind of feels nice too, as well, to be a part of their journey.
Absolutely.
So talking about mental health, I talked about some numbers. I don't know if the numbers correlate, but what is the current state of mental health professionals? And we're here in the US, so we're talking about US today.
I think what's challenging about giving specific numbers is that the research is so varied, and depending on which population groups are studied and which factors of well-being are measured, it's hard to really put our thumb on exactly what's going on in mental health for healthcare professionals. However, what I would say is that it is no secret that healthcare workers, physicians specifically, are struggling. And what we know, your data that you just shared about nearly 50% would say
Yeah.
that they're struggling significantly with some depression. And we don't, that's the people who are willing to admit it. And
Yeah.
so I think it's really hard sometimes to put a specific number on it. COVID obviously was very difficult for physicians and nurses and other healthcare providers. And we, saw a significant increase in psychological distress during COVID and in the years since. Suicide rates, I mean, we will talk about that a little bit further, but something that is incredibly alarming to me, and as you so beautifully spoke about it as well. Uh, there is a significant need for us to be talking about physician suicide and identifying those risk factors in our colleagues and in ourselves and getting help appropriately. And I think one of the things that we don't talk about a lot in medicine is PTSD. And so post-traumatic stress disorder that can happen after the immense trauma that our healthcare providers are experiencing, sometimes on a daily basis. And so they might be experiencing flashbacks and, some paranoia and some avoidance of some of those stressors that cause them that trauma response. And so I think the vicarious trauma cannot be underestimated as well.
Yeah, I'm glad you talked about that because I mean, I don't think people talk about PTSD in healthcare
Mm-mm,
providers so much. Like, I don't think I've ever heard
mm-mm,
in the open. And I think it all became really obvious with COVID as well, because I think people
mm-hmm.
got the time to pause and look at healthcare workers. I mean, it was quite fluctuating because it was positive and negative, and
Mm-hmm.
how healthcare workers are
Yes.
framed. But yeah, amongst healthcare workers itself, I think we saw a lot of acknowledgement of what's really going on. Um, I really want to talk about PTSD, but first, going on to what are, I think, some of the risk factors in this profession that
Mm-hmm.
pose us to mental health. Because for me, I sometimes believe that maybe these are high functioning professionals who are going into this and guess they're facing it anyway, or is it the field, or is it both?
I'm going to say it's both. I think it's really important for us to look at the internal and external factors. So, external factors would be the incredible work hours that we're expecting, our trainees all the way up through our seasoned physicians to continue to produce. And so, long hours, demanding work. Medicine is not easy. And, there's high risk for making mistakes or some kind of error in judgment, and then the feelings that come with that when a mistake might occur. Also, I think so often healthcare professionals don't feel like they have a lot of control or autonomy over even the patients that they serve or the manner in which they serve them. And
Oh,
I hear again and again from physicians that they feel like they don't have enough time with their
yeah.
patients and that they're having to produce and meet these quality measures that sometimes feel um, like they inhibit their ability to really connect. And I think so many go into healthcare fields because they want to connect with their patients. They want to feel like they're making a personal impact on the people with whom they work. And so that lack of autonomy, that lack of control can be really challenging. Uh, also you're working with people. So there's going to be interpersonal conflicts that occur. And healthcare is no different, right? We all have
Yeah.
coworkers with whom we connect really well and feel like they're our friends, and then we might have coworkers that we don't necessarily connect with, and there can be some conflict with that and the hierarchy that goes along with medicine, whether you're in outpatient or inpatient practice. And then I think societally, there's been such a big shift, and I think COVID certainly peeled back
Yeah.
the layer of that. But I think there's so much more skepticism about medicine now than there used to be,
Yeah.
and I think patients are questioning their doctors in ways that they didn't question them 5 years ago. And I think as providers, that's increasing their stress as well. So those are some of the external factors. Internally, the individuals who seek out careers in medicine tend to be high achieving, type A personalities
Yeah.
who can push themselves to the
Yeah.
limit, right?
Yeah.
And along with that, there can be some challenges in terms of anxiety and
Mhm.
depression and that perfectionism, the shame that can go with that. So it's not only the external, but also the people who find themselves in medicine have sometimes
Mhm.
are primed to experience some of those stressors as well.
Yeah, I guess we're attracted to the field. We're all. But I mean, also, I
Absolutely.
think part of this field also, I don't know, promotes it in a way that not taking care of yourself is like a
Hmm.
badge of honor, which I've seen, I think, when I was younger and didn't know better. I thought it was, if I was calling out sick, like that is really bad, like those kind of things.
Absolutely.
What do you think? I mean, where did that come from? What do you think about those?
That's a really good observation, and I would say it's consistent with what I hear from so many others. If we have a resident or an early career physician have a baby or
Yeah.
have some kind of life circumstance that's creating a change in their normal functioning ability, um, and not necessarily in a bad way. It's maybe a really positive thing to get married or to have a baby or something like that. They also sometimes struggle with immense feelings of guilt because they know that what they aren't doing is going to be put onto their co-residents or their co-faculty or their co-hospitalists or whoever it is that they're working with. And so I think that deep sense of internal responsibility that causes an individual to be
Hmm.
interested in this field also it makes it really hard when they do need to step aside for their own mental health or well-being, or when they have life circumstances that create some unique challenges.
Yeah, I mean, you're absolutely right. Like, I wouldn't say how many times I thought about before having my first child if I could really do it, which is like, now
Hmm.
that I think about it, why?
Yeah,
But I thought about the
right.
barriers it would put on others, like you said. Yeah.
Absolutely. And these are the people that we want in healthcare also, right? We want people in healthcare who are going to be conscientious and dedicated and responsible and consistent. So all of these things that we want as patients, right? We want our
Yeah.
physicians and our nurses and those who care for us to be those kinds of individuals. And that also can create undue stress for those healthcare providers.
Yeah. What kind of mental health diagnosis, when you've had interaction with physicians, do you see commonly in
Yeah.
healthcare professional?
Absolutely. So it's not a mental health diagnosis, but burnout is significant, right? And I think you cannot have a conversation about mental health and well-being about physicians
Mhm.
without speaking about burnout. And I think sometimes burnout, it's hard to know if it's chicken or egg in terms of, does our mental health cause burnout or does burnout cause our mental health issues? And I don't know that I have the right answer for that, but I do know that so many individuals I work with experience burnout, and what is important for us to know is that burnout is not a constant state. We can go in and out of burnout. We can have times when we feel more burnt out in our career and other times when we're finding more fulfillment. And so I think even decreasing the stigma around the word burnout and being able to have more open conversation about where I am in my personal and professional journey right now and how that's impacting my mental health. So
Yeah.
in addition to burnout, what we know that healthcare providers struggle oftentimes with depression, and that sense of, when I think about depression, I often think of the depression triad, which is a negative view of oneself, a negative view of others, and a negative view of the future. And
Hmm.
so when we think about that in the context of our healthcare professionals and our colleagues and sometimes ourselves, you know, when you hear colleagues talk about this, when they have such a negative perspective on everyone that they're treating or the healthcare system or administration, or they have a feeling that they're worthless, that they can't do anything right, that they're a constant failure, that nobody likes them. And then they have that sense of hopelessness that nothing is going to change in the future. It's always going to be this way. And my career, this is the trajectory of my career. And
Hmm.
that sense of depression that can sometimes go, that can be present in ourselves and others. In addition to depression, I think anxiety. I think sometimes those who are drawn to the field of healthcare have a little bit higher anxiety, and we can talk a little bit more about that. But
Yeah, and we can
they,
talk about it now. Yeah.
okay, absolutely. So I think our personality, and the individuals who seek out, like, when you think about all that you've been through, all the training that you've done, who in their right mind would do that?
Yeah.
right?
Yeah.
Right? Who in their right mind would go to 4 years of college, 4 years of medical school, 3 to 7 year residency, then a fellowship?
Yeah.
I mean, who in their right mind? You would have to have a little bit of anxiety and a little bit of that
Yeah.
drive to push you to do it.
That
The
makes
hope in
sense.
that is also that these are highly resilient individuals. By the
Yeah.
time you get to your residency, you have gone through some stuff. You have experienced some hits. You've had to come back. You've had to struggle to overcome. So I also don't want to paint it with a negative brush. I actually see it as a lot of
Yeah.
positive in that these are individuals who seek out this career are highly resilient as well.
Yeah.
But the two go hand in hand.
Yeah.
So I think that individuals within healthcare can experience excessive worry, fear. Sometimes it can go into that kind of compulsive behavior of compulsively checking, compulsively rereading things. It certainly can kind of go into the realm of a little bit of obsessive compulsive disorder as well. Panic attacks, avoiding situations in which they had a negative outcome. That's where sometimes we can see a little bit of that PTSD come in as well. Like if you had a really difficult experience with a patient where maybe a procedure didn't go as you needed it or wanted it to go, and then you avoid doing those procedures in the future.
Mm.
So I think anytime we talk about anxiety, what I often encourage people to also think about is avoidance. So because avoidance and anxiety go hand in hand. So the more things that we avoid, the more
Mhm.
anxious we are about it, and the more
Mhm.
anxious we are about it, the more we avoid.
Okay.
So thinking about like where are the areas in which you're feeling avoidant, like you don't want to do it, whether that's a social situation, so it could be social anxiety, it could be in terms of giving presentations, it could
Mhm.
be leading a group. I mean, it can be in all
Mhm.
sorts of different areas, but
Sure.
anytime you see avoidance, there's likely also anxiety as well.
Oh, yeah, that makes a lot of sense. What is high functioning anxiety? Because I see it in a lot of healthcare workers as well.
Mm-hmm. Absolutely. And we use that term all the time, right? Like, I have
Yeah.
high functioning anxiety.
Yeah.
Uh, and so what that means is that these are individuals who struggle with anxiety. They struggle with worry. They tend to be people who consider themselves overthinkers.
Okay.
They have high needs for perfection, and they feel best about themselves when things are going exactly like they need to.
Yeah.
And oftentimes people with high functioning anxiety are not super flexible in terms of
Okay.
how things can go, right? Like, so they're like, I'm fine as long as everything goes the way I need it to go.
Yeah.
And so if you struggle with high functioning anxiety, you may not have some of that cognitive flexibility that
Mm.
is important for us within healthcare. Like things rarely go exactly like we need them to go.
Sure.
And so, being able to roll with that more and be able to flex as you need to flex. Oftentimes, individuals with high functioning anxiety, nobody knows that they're anxious,
Hmm.
so they
Oh, yeah.
appear to be very. Um, I don't love the term, but normal.
Yeah.
They
Yeah.
they tend to be functioning just fine, but
Yeah.
internally they are a mess. The example that I love from nature is a duck. So
Oh,
if you see
okay.
a duck swimming on the water, it's very peaceful. But when you look underneath, you can see their little um, flippers, just their feet just going so fast. That is high functioning anxiety,
Oh,
right?
wow.
This is a person who's looking like they're just coasting through, they're doing great, and underneath their little
Yeah.
they're just going and going and going.
Yeah.
And what's interesting is sometimes when you're with somebody who has high functioning anxiety, uh, you don't realize how stressed you are until they leave, and then you're like, oh my god, like,
Yeah.
oh, they're just like they are at a different frequency. And
Yeah.
so sometimes just paying attention to how I feel when I'm with different people. Uh, these are high achiever, really capable, competent, amazing individuals who are also sometimes really struggling with
Mm.
a lot of anxious thoughts.
Yeah. Okay. Yeah, that's good to know. Yeah, I'm like I was gonna say that earlier, but yeah, anxiety, I've seen it in myself, and I often wondered, did this profession make it worse? Because
Mm-hmm.
maybe I had a little bit of it anyways before, and it just
Yeah.
felt it getting worse and worse. But then I see it in my trainees and the people I work with, and I'm like,
Hmm.
why are we all the same, and why are we not talking about it?
I think that's the bigger question, right? Like the fact that individuals who maybe have a little bit more internal anxiety
Yeah,
seek, end up in professions where they're highly conscientious, regulated, observed, evaluated, all of those things.
yeah,
That's maybe not the curious part. The more curious part is, why are we not talking about it?
right,
Why are we not giving voice to the fact that so many struggle with the same things?
right.
And so many are wrestling with, how do I manage my internal experience in this high stress, high demand environment?
Yeah, yeah, and I think because mental health, and you will talk more about it, is such a stigma per se in itself, just in not up
Mm-hmm.
in healthcare, but even in society in general. And I
Yep.
think COVID kind of made it a little bit better, maybe, that we were
Mm-hmm.
talking about it more. But in this highly perfectionist field, like, how can we talk about it, right?
So before I jump to stigma, I just wanted to also acknowledge that there's higher rates of substance use and abuse. And I feel like we
Yeah.
sometimes are maybe a little more inclined to talk about our anxiety or depression, but substance use is
Okay.
also a real danger within the
Yeah.
healthcare field. And I feel like I'd be remiss if I didn't at least acknowledge that that's also
Yeah.
something that healthcare professionals are not immune to struggling with as well, in addition to all of the other things that we've talked about. So,
Yeah.
as far as stigma goes, I think that one of the things that's really important for us to consider is what is it about stigma, or what is it that makes it hard to talk about these things, right? And I think there's a couple of things that come to mind. One is, it's not safe oftentimes for
Mm.
providers to talk about their struggles because they fear what might happen with their licensing board, or they
Right.
fear what might happen within their administration or their program. And so it's not a safe thing to talk about.
Sure.
Uh, One of the things that I've loved to observe as the 7 years that I've been part of our residency program is how much more open individuals are about talking through their mental health issues.
Yes.
The help seeking is much higher than it was when I started 7 years ago.
Okay.
I think COVID likely contributed. I also think younger people are more open about what they need, what their struggles are. They feel more confident in asking for what the support that they would benefit from. And so I love that generational shift that I feel like is happening. When
Right.
I think about myself, I'm kind of in the middle here. And I think about, my mentors and people who came
Yeah.
before me, and you did not talk about your mental health at all.
Right.
My generation started talking about it a little bit, but definitely what we see, especially with the Gen Z kids who are coming up, they are much more outspoken and engaged around it. And I'm really interested to see, as our Gen Z students, become medical students and then residents, how that actually changes the conversation around mental health and stigma. But as it stands now,
Yeah.
there's a lot of work to do, right?
Right. Yeah.
I think people can feel that if they struggle with a mental illness or a mental health concern, that they're not as professionally competent,
Oh,
and that their competency is going to be questioned by
right.
their peers or by
Right.
themselves, right?
Right.
And so I think that's a really significant factor that contributes to mental health stigma. I also think that, again, I think in some of the older, more seasoned veterans of life,
Yeah.
there's this expectation of resilience. Like, you can't let it
Yeah.
bother you. You just got
Yeah.
to suck it up and keep going.
Yeah.
And if you aren't able to bounce back right after, then there's something wrong with you.
Right.
And, again, my hope is that's going to change as we welcome in a newer generation that's open to talking about it. But as it stands now, there are many in our field who they're not. You just need to suck it up and get on with it.
Yeah.
You're fine. Because I think that illustrates the black and white thinking that so many of us get into.
Yeah.
That if you can't
Yeah.
hack it on this particular day, then what are you doing in this field anyway?
Right.
And that all or nothing thinking and how distorted that is
Yeah.
in like, that's not how life works. Life is so gray. Like,
Mm.
we're going to have good days and we're going to have bad
Bad
days.
days.
And it
Yes.
doesn't mean we need to throw out our career because we had a bad day. I think it's hard for professionals to seek help.
Right.
The old adage that physicians make the worst patients.
Yes.
I think that is
Yes.
likely even
Yeah.
within mental health,
Yes.
that it's very hard to accept and acknowledge that I need some support, I need some help here. And fear of retribution, not just from administration, but also their peers,
Hmm.
fears of what this means about themselves, that perfectionism that we are so familiar with when you're in this
Right.
field, that if I
Right.
can't be perfect, then I'm a failure. And all of that contributes to mental health stigma.
Yeah. And I mean, I've heard conversations about people do get into trouble, like people have talked about it and they have gotten into trouble.
Yeah,
And
absolutely.
yeah.
And
So,
even if they don't get in trouble from the larger organization, they feel like people are looking at them differently. And so it's that
right.
self-perception that I'm not as good as my
Right.
colleagues who haven't been open about their mental health. That doesn't mean their colleagues don't have mental health issues, but
Right.
maybe this person was brave enough to say, hey, I'm struggling. And so they're concerned about what are the closed door conversations about me. Whether they
Right.
are having those conversations are happening or not, there's still that fear.
Yeah. Yeah. And I remember whenever I talk about something like this, then I feel so like vulnerable and raw. And I
Oh,
felt like, why did I do, like it's like instant regret. Like, why did I do it?
absolutely.
Yeah.
Absolutely. And how sad is that? But
Yeah.
I absolutely hear what you're saying. And that
Yeah.
vulnerability is so powerful.
Right.
All we need is for shame to continue, we just need secrecy, right? And
Yeah.
then when we're vulnerable, when we're able to say, I'm struggling here, then that opens the door to all the other individuals being able to come forward and say, yeah, me too.
Yeah.
And but we need sometimes that person to be willing to be vulnerable first. And that is scary. It's so scary.
Yeah.
And it's also what builds connection. And so it's incredibly powerful.
Yeah. Absolutely. Yeah. I agree with all of that. How can we recognize, I guess, some signs of anxiety if we're seeing it in ourselves, in our colleagues, or depression? And
Yeah,
you talked about the
absolutely.
depression triad, but um, some other signs and symptoms that we can see in ourselves and our colleagues.
Absolutely. So what I would say is pay attention to any difference in functioning, right? We all have ups and downs in our mood. We all have good days and bad days, or seasons where we feel like we're doing great and seasons when we feel like we're really struggling. So, I certainly want to normalize that life has some ups and downs.
Right.
When we're talking about more mental health diagnoses, what I like to think about is intensity and duration.
Yeah.
So is this a change in function? So this isn't just some anxiety that you might have because you have a really busy couple weeks coming up. You're going to be traveling to give a presentation, and then you also have, something that's going on at work that's going to be increasing some stress there. That's pretty normal anxiety. But
Yeah.
if we're feeling anxious all the time, so much that it impacts our ability to function, to engage with our family, to engage with our friends, to engage with our patients and coworkers, then we're starting to have some concerns.
Okay.
Also, changes in sleep, if we're not sleeping at all, if we're sleeping all the time, changes
Mm.
in appetite, feeling like we need to pull back. So, social withdrawal, that sense of like, I just need to cocoon and kind of be all by myself because I don't want to be around people right now. Um, Sometimes even just increased sensitivity to stressors, whether that's, a new person coming on staff and that's the stress,
Yeah.
or whether it's even, increased sensitivity to light and sound and
Mm.
textures, like you're just feeling raw. And
Yeah.
that can be an indication that that maybe we need to pay attention to more what's going on. I would also say increased absenteeism.
Mm.
So, calling into work sick more often than you typically did.
Mm.
And even if you're not that sick, and
Mhm.
I'm all for mental health days, and I think
Mhm.
sometimes we all need them. But if you're noticing that they're happening more frequently, or you're noticing a
Sure.
colleague is calling out more frequently,
Sure.
And then there's also something called presenteeism, where you're
Mm.
at work, but you're not at work.
Mm.
You're not really doing
Okay.
what you need to be doing.
Yeah.
Your body is there, but you're not engaged. You're not
Mm.
engaged in what needs to be going on. You're just coasting. And I think that sometimes is also an indicator that we need to have a deeper conversation or deeper reflection on what's going on. Feeling apathetic, disconnected, more irritable. If you have a resident who's been really fantastic and been doing a really great job, and then they now are starting to miss things, or they're starting to make more errors, that could be that their learning curve is kind of
Mhm.
steepening out. It also could be that there's more going on and maybe worth a conversation.
Yeah. How do we, and I know maybe we've talked about this in the past, but how do we approach if we notice that one of our colleagues is being more absent or one of our
Mm-hmm.
residents? So how do we approach that
Yeah.
conversation tactfully without making them feel that vulnerability, I guess?
So hard. It's so hard. And I think about that often with our residency program, you know, the how do we have conversations that are hard with our residents?
Yeah.
And then also just as a professional, how do we do it with our colleagues? I think what I recommend is for us to keep it more about what we've observed versus what we think.
Mm.
So
Okay.
I've observed that you've been missing work more frequently, or it seems like, I've observed that you've been more irritable. I observed that, you seem more tired. You've been
Mm.
talking about feeling more tired, whatever, and keep it to things that we can observe versus, I think you're depressed.
Yeah.
I think you're depressed, or I think you're really anxious. I think it's much more like, can we make it tangible here? Can we say, like, these are the things
Yeah.
that I'm observing, and as your friend, as your colleague, as your boss, as your supervisor, whatever role we might be in, can we reflect that to them and say, these are the things I've observed, and I'm concerned,
Yeah.
and follow it with that. I'm concerned. I'm worried about you. I just want to check in. How are you doing?
Yeah.
And I also love I don't know who came up with it, but they say, how are you doing really? And adding that word
Mm.
really at the end, because I think so often we're quick to say, I'm fine.
Yeah.
I'm fine. I'm doing good. Thumbs up. But if
Yeah.
somebody says really, like, how are
Yeah.
you doing really? Then I think I'm going to be more inclined to reflect and think, gosh, how am I really doing?
Yeah.
And huh, I I'm doing okay in this way, but maybe not so much in this. And
Yeah.
I like adding really when we're having a conversation with someone.
Yeah. I'm gonna remember that. Yeah, I should do that more often. But yeah, that's
It's
a
beautiful. I wish I could take credit for it, but it's a beautiful idea.
yeah, that's awesome. Um, Briefly, do want to talk about just connecting from that when you said people appear fine on the surface. This
Hmm.
has been my experience, and trigger warning for anybody. We're going to talk about suicide, but um, I've noticed people every few months. I notice that there's a person who did suicide and they're in healthcare. And
Hmm.
I'm really curious about this. I usually go back on their Instagram profile or Facebook profile and they're fine. And so, just talking about suicide, I mean, we talked about it is very common in healthcare professional. We
Hmm.
are at high risk.
So the research, the more recent studies have shown that male physicians have approximately a 40% higher risk of dying by suicide than their non-physician peers, and female physicians, have an increased rate of 130%.
Oh, well,
So that should be alarming for all of us to hear.
sure.
To think about our colleagues, our friends are struggling. And I believe, I think I've shared this with you personally, but I had a dear friend of mine die by suicide who was a clinical psychologist, and she died. It's been probably almost 10 years since she passed away. But one of the things that I thought was so interesting was when I went to clean out her office, because I helped her family clean out her office and notify her patients. She had on her desk all of the cards that you would give to a suicidal patient,
Mm.
that have the crisis line, and you are not alone. And she had them sitting on her desk.
Oh my God.
She knew what to do. She knew
Yeah.
that she could call At that time, it wasn't 988, but now we have the 988 suicide crisis line. But she knew the phone number that she could call. She was very effective and efficient in helping other people. But when it came to herself and her own mental health struggles, she felt at a loss. And so, when I speak about this topic, I speak from a place of lived experience of losing
Yeah.
somebody that I had no idea. I was probably one of her closest friends, and I had no idea that she was struggling in that way. And so, I think it can absolutely hide in plain sight. We can have friends and colleagues who are struggling, and we have no idea. I think being willing to have the conversations, being willing to say, when you are talking to a depressed friend or a depressed colleague, to say, are there times when you felt like you just can't go on or that you don't want to be here anymore? And that might feel like you're being too clinical. That might feel like, oh, well, you're trying to, be my doctor right now or whatever. But
Yeah.
honestly, I'd rather ask.
Yeah.
If I could go back in time and ask my friend, like, have you ever thought about suicide? Have you ever thought about that you don't want to be here anymore? I don't know what she would have told me. I have no idea. She might have said, no, I don't think about that. Or she might have been able to say, yes, I do. I've thought about that. And then we have this opportunity to have a conversation about something that's really hard and to help her potentially get the support that she needed that she didn't have. So what I would say is it's so much better to have the conversation. It's so much better to ask because we know that we are in a high stress field.
Yeah.
And we're in a field where shame is so prevalent because we feel that internal sense of distress when we make a mistake. And instead of saying I did a bad thing, it becomes I am a bad person.
Bad person. Yeah.
And, when that shame starts growing along with the hopelessness, it puts so many of us at risk.
Yeah. And I'm just curious because you do this professionally as well, right? Like you're a psychologist.
Mm-hmm.
Why do people feel that they cannot reach out? I'm just curious, like from your experience when they're.
Yeah. Okay, so this is really interesting. The first thing that popped into my head was I think sometimes people think that others don't care,
Yeah.
which is not true, but it goes along with that depression and that sense that nobody likes me. And so I think sometimes people don't talk about it because they think nobody's really going to care or everybody's got stuff going on. Everybody else has really challenging lives or everybody else has stress, so they don't care about me. And I think that's so sad that people are thinking that way because the reality is we do care.
Yeah.
Those that are in your life absolutely 100% care. And we may not always be perfect in the way in which we show it. We may sometimes miss the ball, but it doesn't mean that we don't care. And so I think my first thought was that. I also think that then there's this fear of, are they going to think I'm less competent if I share this?
Yeah.
Are they going to think that, oh, they can't trust me with their patients because they're worried that I'm going to do something irrational or extreme when I'm caring for a patient? And so then there's also that fear.
Yeah.
I think that sometimes it's also like, I certainly as a psychologist, I hear this, who would I talk to? Because I'm friends with all of the, so, and I've thought that personally when I thought about my own mental health journey, like if I wanted to go to therapy, who would I see?
Yeah.
Like,
Sure.
We don't live in that big of a community. And, who would be the person that I would choose to see? So I also think sometimes there can feel like there's a lack of resources. I don't know that there are an actual lack of resources sometimes. Certainly in certain parts of the country there are. But I think sometimes it's our perception. Like, well, I couldn't talk to so-and-so because they go to church with my sister and then they're going to think,
Yeah.
we come up with all sorts of reasons why we can't talk. And then, like we talked about the stigma associated with it and fears of if I have a diagnosis, if I go to the psychiatric hospital because I'm suicidal, is that going to then get reported to my licensing board or my hospital where I work or my clinic, and it's going to have negative ramifications. So I think there's a lot of fear associated with speaking out.
And I was going to ask this at the end, but just because this is a heavy topic, and if someone is listening, I do want them to plug this right off it. If someone who is struggling with
Mhm.
something like this, and if they're going a mental health crisis, what would you like to tell them, and what should they do in this moment? Yeah.
Yeah, absolutely. What I'd like to say is you're not alone. That I've lost now 3 people to suicide, and what I would say is every one of those individuals, there were people who absolutely cared, and there were absolutely people who were left behind, and uh, the impact of the loss was significant. And I don't think any of those individuals realized how significant the impact of their death would have on those around them. The ripple effects of um, that loss and the grief that happens. So, first of all, I would say you're not alone. And there are people who care about you and who want to support you, imperfectly as it may be,
Hmm.
want to support you.
Hmm.
There is absolutely hope. There is, I am a ardent believer of hope. And I think that as long as we are alive and connecting with one another, there's hope. And so, there's this that doesn't always have to be this way. And to know what your resources are, that, certainly there's 988. And I think as a professional, that can feel really uncomfortable to reach out to a suicide hotline, but I would encourage anyone to do it. And if you feel like it wasn't a great experience, call again, because you'll probably get somebody else, because there's different people who answer the phone. And you may not connect with the first person you talk to, but there's other people you can talk to. So, 988 is a fantastic resource. Talk to your EAP, your employee assistance program. Many of our agencies with whom we work offer employee assistance programs. Talk to them. If you need to take it to the next level and go to a treatment center, absolutely, to do that. So I would first of all just say you're not alone, and there's resources and help out there.
Yeah, absolutely. And I think I would reiterate that to anybody who's listening, that you're not
Mm-hmm.
alone.
Absolutely.
How do organizations, I guess, play a role in preventing
Mm-hmm.
this? And how can we support a culture where mental health crises are more accepted and people are not worried about sharing it? I think there is a huge role I personally believe that organizations have to play in preventing this from happening. And
Mm-hmm.
I would really wish we can give them some creative ideas, I guess.
Yeah. Well, so what's fantastic is the American Medical Association um, did a paper not that long ago. Unfortunately, I don't have the date off the top of my head, where they made
Mm.
some concrete recommendations.
Okay.
And so we don't have to come up with them all on our own. So I
Okay.
would
Perfect.
recommend that if
Yeah.
somebody is interested in it's, the American Medical
Yeah.
Association, I believe it's Physician Wellness.
Yeah.
And what they talked about was, first of all, kind of look like a top down perspective. So looking at what do we need to do from a state licensing perspective? How can we change the language that individuals, when you fill out your license renewal or applying for the first time, how can we reword some of those questions that are really stigmatizing to mental health,
Right.
and have them more about impairment? Are you struggling with any condition that impairs your ability to appropriately,
Sure.
provide medical services, versus have you ever been diagnosed with a mental illness?
Okay. Yeah.
Because perhaps you struggled and now you're doing better because you got help. And so I think we could, from the top down, thinking about what can we do? We can change licensing language. State legislation can be changed to protect physicians so that they have the opportunity to report if they're struggling without that retribution coming back on them. So safe haven laws. The medical societies can do more to support that in offering resources.
Mhm.
And then when we get to organizations, an organization having something like an employee assistance program, or having maybe a web page on their organizational site that's
Mhm.
all for healthcare, mental health. And perhaps there's like links to helpful resources on the internet, or local mental health providers who specialize in seeing healthcare providers. I think we could do something like having mentorship programs within
Mm.
like a med school or peer support programs. I'm potentially going to be part of a peer support program initiative within our med school. And that's really exciting to me to think about how we can support one another in a way that is non-clinical
Yeah,
and maybe more open and allows for some of that vulnerability. So I think there's many things that can be done all the way from national on down
yeah.
to help individuals who are struggling.
Yeah, absolutely. Yeah. And I think peer support programs are really important, and it's really exciting that you're going to be part of it. But also, yeah, creating common language around it so it's not just so hard,
Mm-hmm.
and creating more those conversations out in the open, I think, because it's very important as well.
Absolutely. Well, and I think you giving voice to this topic through your podcast and other
Yeah.
writings and things that you've done, I have so appreciated
Yeah.
your vulnerability. And I think what has helped me is hearing you be vulnerable, and it's helped me feel more comfortable to be vulnerable. So I think there's that circle that
Yeah.
happens when we're around people who are allowing us to be ourselves and
Yeah.
allowing us to have open conversations. Then it just creates, really positive feedback loop.
Yeah, absolutely. Yeah. I'm glad to be able to do that because the thing that I was going to say next is, it wasn't for me, not always like that growing up, and it's not for a lot of people.
Mm-hmm.
A lot of times, just asking about how, as an individual, can cope with such a stressful field, I would say, because
Mm-hmm.
many times people would tell me that you got to become more thick skinned, right? Just
Yeah.
which I think we're all smart. That's why we're here. And you said we are resilient. That's why we're
Mm-hmm.
here.
Mm-hmm.
So the onus is not entirely up to us to fix it, but I do want to
No.
know how we can make it better for ourselves individually as well.
So what I'm thinking is if we're talking about more significant, serious mental health issues, such as suicide, like we talked about earlier, just acknowledging that you're struggling and reaching out for that support, so using a crisis hotline if you need to, those kinds of things. But if we're talking about just the
Daily
more
life.
run of the mill, like
Yes.
I'm really struggling with some anxiety, my mood is not as great, I
Yeah.
think there's a couple of things we can do. I think, first of all, just talking to a trusted colleague or friend
Yeah.
and just being open about what's going on. Taking a break if you need to. So sometimes our burnout or our stress is really related to the fact that we're not leaving work at work
Yeah.
and we're taking it home with us, and then it's bleeding over into our personal lives, and it feels like you never get away from it. And so I think being able to take a break and maybe practice some boundary setting, which is hard to do, I recognize, but when possible, trying to take a break. I think so many people underutilize their vacation days.
Yeah.
When I think about how many, and you don't even have to be working for a program that gives lots of vacation days, just using the days that you have,
Yeah.
I think is so important. And even if you use them and just do a staycation and stay home and get caught up on laundry and go see some movies, that can do a lot as well. I think that um, engaging in whatever self-care looks like for you.
Yeah.
So having hobbies that you enjoy, doing things in your life that fill your cup. Because I
Mhm.
think as healthcare providers, we're constantly pouring out into others. And so what pours into you, whether that's, kayaking or being in nature or crocheting or journaling or art
Mhm.
or music, or, I mean, it could be anything. I
Yeah.
think sometimes we think self-care has to be these very prescribed behaviors, like go get a massage or something like that. And sure, that's great if you like that, but maybe not everybody can do that. So I also think just whatever self-care looks like for you. And I think that just means that in that moment, you feel cared for. You feel like I'm listening to what I want to do, making sure that we're eating and getting the sleep that we need, um, balancing our internal demands, that we have so often in our jobs with maybe some physical things. So movement that feels good to us, um, engaging in ways that help us feel like liberated or free in how we can engage in our world versus being in a hospital all the time or a clinic all the time. So those are some ideas. I think there's so many other strategies and things that people can consider, but I would encourage people to reach out, but also to do things that feel good to you.
Yeah. And I think what I've done, and maybe really helps me in that, is finding the person I am outside of work. So,
So
uh,
good.
for people who didn't know, Dr. Hopper just hiked Kilimanjaro. So I know she talked about her hiking and how is that the person outside of work. And for me also, just I think that really helped me to know what am I when I'm not at work, and
I think that's so important. And I think that so often we begin to see our whole identity as what we do
yeah,
for a living, our vocation. And instead, thinking, you are so much more than a physician.
yeah,
You're a mom, a daughter, a friend, you are a writer. There are so many things that you are
yeah,
beyond a physician.
yeah, absolutely. Thank you so much, Dr. Hopper, for coming to do this with us today. It's always such a pleasure to talk to you, and I think I always learn something for myself, and I'm sure our audience will learn something great too. I do have this tradition that I try to end my podcast with a poem, so if you will stick with me for that.
Okay, absolutely.
Today, I was going to read So Much Happiness by Naomi Shihab Nye. It is difficult to know what to do with so much happiness. With sadness, there's something to rub against, a wound to tend with lotion and cloth. When the world falls in around you, you have pieces to pick up, something to hold in your hands like ticket stubs or change. But happiness floats. It doesn't need you to hold it down. It doesn't need anything. Happiness lands on the roof of the next house singing and disappears when it wants to. You're happy either way. Even the fact that you once lived in a peaceful treehouse and now live over a quarry of noise and dust cannot make you unhappy. Everything has a life of its own. It too could wake up filled with possibilities of coffee cake and ripe peaches. And love even the floor which needs to be swept, the soiled linens and scratched records. Since there is no place large enough to contain so much happiness, you shrug, you raise your hands, and it flows out of you into everything you touch. You're not responsible, you take no credit, as the night sky takes no credit for the moon, but continues to hold it and share it, and in that way, be known. Thank you so much, and it was such
Thank
a
you.
pleasure to have you here today.
Absolutely. Anytime. Thank you.